retraining my brain to do some stuff that I had just done no problem before. And then kind of also coming to terms with a different identity because I was a different person. Like, you don't really realize that it's going to change you the way it does. And so it's kind of, the focus of the event is to talk about that and what happens after. So panelists will give little introductions, who they are, where they're from, and stuff like that. So, take it away.
I guess this is on. Can everybody hear? Okay. My name is Bud Bernier. I'm a physician in Cambridge, Minnesota. I work for Alliant Health. I do primary care orthopedics and also do sports medicine with concussion management. We utilize the IMPACT program that I would imagine a lot of you have heard of in order to use that as one tool to help us to predict when our athletes are ready to return to their sport. I've been a physician for 25 years. I've been in Cambridge for 22 of those, and have been doing sports medicine there for about the past 10 years. Really happy to be here. I appreciate coming down to Gustavus. I get to combine this visit with a visit to my sons, who are both students here at Gustavus. My son Joe is a senior, and Sam, who has a presentation here, is a sophomore. So I really appreciate you having me here and happy to take part in this.
This working? Okay, cool. Hi, my name is John Anderson. I'm 24. I'm a student here at Gustavus. I'm originally from Appleton, Wisconsin. I have a younger brother, Eric, right out there, who's a senior. Goes here as well. I had a traumatic brain injury. It'll be 2 years coming up at the end of this month. And I was in that car accident, spring break, a couple of years back that some of you probably heard about. And I guess so traumatic brain injuries are on a spectrum from mild to moderate to severe. I fell in the moderate category, and they use something called a Glasgow Coma scale. I believe that it's on the scale up to 15 points, and the number you get, it's the kind of the most accurate prognosticator they use initially after the injury. So I fell in the moderate range, and so I've regained most of my brain function 2 years out here, and I still struggle with something called neurofatigue. Basically, it's like what you get when you study for finals and you get cognitively overloaded, and you just kind of need to hit the off switch. You guys know what I'm talking about? You know, I've learned it's really hard to describe some of these things, and a lot of people can't really relate to the feelings, but you know, I try and still getting better. That's you know, good to know, and I try to keep a positive spirit, and so would like to first thank Sarah for putting on this presentation, this panel here, and so I'm excited to be here.
My name is Linda Mabs, and I am a speech-language pathologist from Hennepin County Medical Center up in Minneapolis. Hennepin County Medical Center is a level 1 trauma center, and I've worked there for more years than I'm going to admit, but for the last 8 years I have been devoted primarily to the outpatient, mild to moderate traumatic brain injury program there. This program started in about 2004. It was spearheaded by our current medical director, whose name is Dr. Sarah Roxwell. So I don't know if any of you have heard of her, but it started very small. There were only 4 very part-time medical professionals devoted to it at that time. And it has really turned out to be one of the biggest growth programs at Hennepin County, and it continues to be. Back in 2004, we saw only 168 clients in the clinic, and Last year we served over 1,400, and in 2004 the therapy visits were only at 306, and this past year we had almost 6,000 therapy visits. And so it has really been an area of growth for the hospital, and I think just with the increased awareness of mild brain injury recently has contributed to that. We are part of the interdisciplinary team. We have lots of different specialties. We have physicians, nurses, occupational therapists, speech pathologists, physical therapists, clinical and neuropsychologists. I'm going to forget somebody, but I feel like I'm at the Academy Awards or something. Social workers, and then we also have ancillary services with neuro-ophthalmology and audiology services. So our primary role is to work together as a team to address the needs of patients who have suffered a mild brain injury, and we normally refer to that as concussions, who are experiencing a variety of post-concussive symptoms. And John, I think, mentioned a little bit about it, but post-concussive symptoms can be physical in nature. Those can be the headaches, the fatigue, the noise and light sensitivity, some vestibular issues, sleep disturbance, visual changes. It can be emotional in nature, and Sarah mentioned that, just the adjustment issues, the mood changes. Our patients often have increased irritability, difficulty managing anger, and some depression as well. And also the cognitive, which is the thinking part of the injury, the things that involve the difficulty they have sometimes in sustaining their focus, memory, learning, speed of processing in particular, a lot of changes in that way. And that's what I, as a speech pathologist, direct my attentions to mostly, is the cognitive piece. I do a lot of education regarding brain injury recovery, curve, and healing. And we stress a lot the idea behind energy management for recovery of our patients. That has a lot to do with cognitive rest, physical rest after the injury, and then ways to reintroduce activity in a manner that doesn't exacerbate your symptoms. And then we address the cognition from a compensatory standpoint, ways to get around it while you're recovering, and then direct treatment of the areas. I just want to say a couple things about concussions. And I didn't know I was going to have a doctor on the panel, so he's probably going to be all over me on this. But historically, concussions have kind of been considered no big deal. People get their heads knocked, they see stars, and they get up and go about their business. But it's more recently that they've been actually calling it what it is, which is a mild brain injury. It's an actual injury to the brain. And it's gotten a lot of attention recently, I think, because of vets coming back from the Iraqi war with injuries, just being in the vicinity of a blast, not having a direct injury, but having post-concussive symptoms. And then the renewed interest in sports-related injuries in high school and college, and even more recently at the professional level. The NFL, I'm sure you've all heard about that, and some of the concerns about the long-term impact of repeat brain injury. And it is true that the majority of people do get better after brain injury within a matter of days or weeks, but there is a percentage of that population that has more persistent, long-lasting symptoms. I've heard estimates everywhere in the literature from 5% up to 15 or 20%. And there is an increased risk for those under the age of 25, especially with the sports injuries, the impact on brain development, that arc of brain development that is still happening with you guys, and on their academic performance and the ability to actually get back to their sports. And so there's a lot of debate about why this happens, why some get better, why some don't. Historically, they've kind of written it off to psychological reasons, pre-existing conditions, or if there was some secondary gain. In our clinic, we work with kids from age 13 on up through adults, so I do work with a lot of adults. When we talk about secondary gain, we just mean things like litigation, workman's comp issues, those types of things that they think sometimes motivates people to have concussive symptoms. But I have to say, with my experience with the individuals that I work with, that it can be quite debilitating, and it can be long-lasting. And I've had people who have lost their jobs, who have gone back to work and been fired. I've had kids that go back to college and aren't as successful as they were before their injuries. And so it is really an area of interest to me, biggest areas is that we just need a lot more research about it. I think there needs to be some research that develops some imaging that can kind of tell us what's going on with the brain. I think CT scans are usually chosen, and with a mild brain injury, it's almost always negative because it's not sensitive to the axonal injuries that take place when the brain is twisted or torqued around. And I think there needs to be research about why some people get better and some don't. Are there genetic markers? Is there something that makes someone more tend to have longer lasting symptoms than others? Is it gender related? Is there any relationship to cognitive reserve? So I'm going on a little bit here, and then the last thing I'm going to talk about is the importance of education and that people, if research can, and I know there's a lot of research going on, but if it can lead to people like you and people who are in sports and active, and I know there's a lot of good brains out here, but it's the only one you got, and so protecting it and making choices based on knowledge. So thank you.
Hi, I'm Molly Viskevich, and I am an education specialist with the Minnesota Brain Injury Alliance. A little bit about the Brain Injury Alliance. It's a nonprofit organization. We're based out in Roseville, near the cities as well. And in my department specifically, I was just going to review some of the services we offer there so you guys are aware of what we do. But the department I'm in is specifically for education and outreach, so we go to anywhere in Minnesota that wants training. So we'll go to the VA, we'll go to schools, we'll go to nursing homes, police stations, churches, whoever might be interested in training on brain injury. And we also go to do community outreach, so we'll sit in homeless shelters and places of underserved communities so that they're aware. Because the biggest thing is raising awareness on brain injury. So we try to spread the word. So that's my department, and then we have several other great departments. There's a case management department, and the case management department is full of contracted case managers who work in both Hennepin and Ramsey counties, and they specifically work with people who have waivers. To be eligible for a waiver, you need to be certified disabled and have medical assistance. It's just an extra pot of money so that you can receive services like, someone might need assisted living or corporate foster care or more independent services like ILS, independent living skills that help them to be more independent in the community and just help them to empower them. So those case managers make sure that those individuals are being, that their needs are being met. And then we have a resource facilitation department. This department is really unique because it also serves the whole state of Minnesota, and it's a free service. Anyone who is interested in brain injury, whether you have experienced it yourself or you have a family member or a friend that has it, you can call this resource facilitation department, and they will, whatever you want to know, they have resources, and if they don't know, they'll find out for you. And then if you do have a brain injury diagnosis, they will work with you one-on-one and help get you resources. We've had people that have entered the program that didn't start out with a medical team, and they didn't have a doctor, they were homeless. They got connected with resource facilitation through community outreach, and they now have a medical team and are working with a case manager to get services that support them. So that's a unique department that we have. And then we have volunteer department, and a lot of our volunteers consist of people who've had brain injuries, and so they want to either get back into the community or they're on the speakers bureau and they want to go places to talk about what's happened to them. And then our last department is the legislative department. That there's 3 people that are working in that public policy department, and they really help go to bat for people with disabilities and brain injury and make sure that there's not more budget cuts for people with disabilities. So those are all the departments. Feel free to visit our website. It's www.braininjurymn.org. And it is Brain Injury Awareness Month this month. Stroke Awareness Month is in May. And thanks so much for having me here. Appreciate it, Sarah. Thanks.
Really? Can you hear me?
Yep.
Okay. Hi, my name is Mariah Walsh.
Anyway, my name is Mariah Welsh. I'm a junior here at Gustavus. I actually got a concussion December 2012. December 2012. I was in cheerleading and a cheerleader. We were stunting, and her butt bone landed on my head. I actually have the dent in my skull still. Getting over it wasn't really that hard, but now it's more difficult because when she landed so that my head angled itself, which caused all the muscles and fasciitis in my neck and shoulders to be stretched out, and like when it was trying to get back together, it clumped in the wrong way. So now I have therapy that I still go to where they try to straighten out the fasciitis so that I can no longer have headaches and can focus and pay attention in class and stuff. And I want to thank Sarah for having me on the panel. It's very nice of you.
I'm Troy Vance. I'm our head athletic trainer here at Gustavus. I've been an athletic trainer for 13 years now, 10 here at Gustavus, and I am primarily the one that's going to recognize the injury on the field of play and help remove them. I started as an athletic training student in 1996, and I've seen it go from someone gets hit in the head on the field, asked how you feeling, 15 minutes later, you feel okay, go back in the game, to now where we have better recognition and early removal from competition. So that's one of our goals here at Gustavus, is that